Dr. Jeffrey Watson. Stay tuned to the Healthbeat Show. We're going to be talking about preventative ways of living. We'll be talking about exercise. We'll be talking about eating regularly with 5 minutes of flavor and down-home healthy cooking. We'll be talking about the science of health. We will be talking about the changing healthcare system, about insurance, about what types of doctors do what types of things. We'll be answering your questions. If you want to find out any information about your health, the health of your family, or the changing healthcare system, contact us at healthbeattv.info. I'm Dr. Jeffrey Watson. Welcome to the Healthbeat Show.
You have everything. Take my word, but I heard about the Healthbeat you're gonna be. How you wanna be? Show me how it will be. How you wanna be? Show me how it will be. Listen to the show, the more you'll know.
Good morning, I'm Dr. Jeffrey Watson. You know, health is a state of spiritual, socioeconomic, psychological, and physical state of well-being, not simply the absence of disease or being in the hospital. I am a board-certified internal medicine physician. I've been practicing in Oakland for over 30 years. I practice in the hospital and I practice in the office, and often I come to you at your church or your community event with health fairs. Watch the Healthbeat Show. We'll be talking to you about how to live healthier. We'll be talking to you about disease prevention. We'll be talking to you about how to think correctly, everything from your nose to your toes. The 8 healthy guidelines of living. Watch us on the Healthbeat Show. You will learn truly that your health is your wealth, and when you have your health, you have everything. I'm Dr. Jeffrey Watson. Watch the Healthbeat Show.
The Healthbeat Show, sponsored by Watson Wellness Water. Your health is your wealth.
And welcome to the Healthbeat Show. I'm Dr. Jeffrey Watson, and we've got a wonderful show here for you today. We are going to be talking about some of the changes that have been occurring in healthcare and some of the changes that you may see coming forward in the future in the healthcare. Joining me today is a very wonderful young lady who is a registered nurse, and she is a nurse practitioner in training. And her name is Jamie Zerkria. Yep. Did I pronounce it right?
That's right. Yeah.
Okay. Well, thank you for being here on the Healthbeat Show. Okay, and Jamie, you have been already trained as a registered nurse.
For about 6 years, a little over 6 years now.
Okay, and where did you work after you became a registered nurse?
So right after graduation, I worked for O'Connor Hospital in med-surg oncology.
Okay, so you dealt with surgical cases and cancer cases.
Yes, lots of cancer
Something
cases.
very important.
Yeah.
Now, what is the difference between a registered nurse and a nurse practitioner? What's your training for now?
Yeah, so a nurse practitioner role, actually California was one of the first places to start up the role of the nurse practitioner. So that people had seen a need for it actually. After President Obama came into office and started the healthcare reform, he saw a greater need in especially like rural areas. Where health demands were much needed because there's a shortage actually in physicians in those areas, and so the nurse practitioner role got developed. So basically we work in California, we work in conjunction with a physician under their supervision and pretty much do a majority of the role that they do, and it's supervised and
Yeah, so it's pretty much, you can do most of the things that a doctor can do.
Sure can.
So you can check blood pressure, diabetes.
Yeah.
You can do pap smears.
Manage, diagnose, and treat.
Manage, diagnose, and treat. The
Yep.
same thing that a doctor would do.
Yes.
And write the prescriptions.
Absolutely.
And
yes.
refer people to a cardiologist or orthopedist or a surgeon or a cancer doctor, just like you
Yes.
talked about.
Absolutely.
Now, where are you in school for the nurse practitioner training, and how long is it once you've completed a registered nurse degree?
So right now I'm at Samuel Merritt University in Oakland, and it's an 18-month intensive, just full-time program right now. But you do need some prerequisites, of course, before you get into the program, as being a bedside nurse and having experience already working hands-on with patients bedside in conjunction with physicians as well.
Okay, and so you are doing your externship
Yes.
here at the
Yes.
James A. Watson Wellness Center. And how is that different from working as a bedside nurse?
It's very different. So working as a bedside nurse, you always have that extra cush to fall under. So you always have
You follow the doctor's orders.
Yes, and we always have somebody to call if something is not within the normal range. Here, you're just you're on your own. You learn to be independent and self-sufficient, and learn to.
You have to
everything.
think a different way.
Absolutely.
So when we train you here at the James A. Watson Wellness Center, which is a training center, we train nurse practitioners, we train young physicians, we train physician's assistants, medical assistants, phlebotomists, while we are providing care at the same time. But you now have to, as you indicated earlier, make the diagnosis and then provide the treatment.
Provide the treatment. do
Without
everything.
an order from the doctor.
Correct. Doing everything from A to Z,
So
top
it-
to bottom, referrals even from day one. You're just doing everything.
And it makes you much more independent.
It does. And it makes you think, it takes you from a place of critical thinking to critical reasoning. So past the bedside.
Very good, very good. Well, here today at the James A. Watson Wellness Center, we are able to address the number one cause of death, and that is cardiovascular disease. Cardiovascular disease. And one of the ways that we do that is through a test called an echocardiogram. We can also look at strokes, and we test the blood vessels to the brain by doing carotid Doppler. Test, and then we look at the blood vessels of the legs. People with diabetes often will have what we call peripheral vascular disease, and we look at the aorta. So later today, we'll be looking at Ben from Silicon Valley Medical Center performing those tests on some of our patients. And we have, just incidentally, in doing our screen in 2017, we have found cardiac disease and strokes in the making and been able to prevent them. I'm Dr. Jeffrey Watson. We're right here at the James A. Watson Wellness Center, where you will always hear me say that your health is your wealth, and when you have your health, you have everything. Stay tuned. Watching the Healthbeat Show. We'll be right back after these very important messages. Stay tuned.
When I was 6, my days were spent playing basketball. When I was 6, my dream was to make it to the NBA. When I was 6, my mom had a stroke.
I'm Paul George, and I want you to spot a stroke fast.
F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911.
Protect the ones you love.
Spot a stroke fast.
We're right back here on the Healthbeat Show with none other than nurse practitioner in training, Miss Jamie Satira. Did I pronounce it right?
Zakaria.
Zakaria, okay. Now, we talked about what healthcare was like when you first became a nurse in training, and now healthcare may be changing under what we call the repeal of the Affordable Health Care Act, or the repeal of Obamacare. The new president is attempting to make changes. What do you feel about that? Do you have any thoughts about it?
So with everything that's been going on with the new healthcare reform, working inpatient, with that healthcare reform being in place, I saw a lot more people looking for preventative screening. And this kind of opened a door for people to allow them to get these screenings at more of an affordable cost, or little to no cost actually, which actually would prevent a lot of disease and chronic comorbidities for people. But with things going on now, it's kind of up in the air. So
yeah, we don't really know exactly what's going to happen. At least we knew what was to come. Now they're saying that the bills may have to go through Senate, and they may have to be modified, and we just don't know what is to come. But we do know one thing that is to come here at the James A. Watson Wellness Center, and that is a program that you and the other nurse practitioners have designed.
Yes.
And tell me a little bit about that program.
So actually, we're going to be doing a whole women's health program here at the James A. Watson Wellness Center. We're going to do this every Wednesday, and we're going to have lovely services that include breast exams with referrals for mammography, preconception planning, counseling. We're going to do pap smears on site with cervical cancer screening as well, pregnancy prevention, including counseling and birth control, and also evaluation and treatment of urinary and vaginal infections, including lab work. So.
All right, that's fantastic. And how many nurse practitioners in training do you think will be with you providing this program?
I would say around 5 or 6 of them.
Yeah. We're very excited about it because we know that the women are our mothers, and they play such an important role in the healthcare system. As a matter of fact, they usually get the men to go get checked out.
Absolutely.
The men are too scared. So later we're going to have to get you to put together a program for men's health too. We'll be doing that down the line. I'm Dr. Jeffrey Watson. We're right here at the James A. Watson Wellness Center, where you will always hear me say that your health is your wealth, and if you knew better, you could do better. Stay tuned. We'll be right back. And welcome to the Healthbeat Show. We are here in the kitchen, none other than the wonderful health chef, Chef D, otherwise known as Mr. Daryl Delahunty. Welcome to Down Home Healthy Cooking.
Well, thank you, Dr. Watson.
And
it's a pleasure being here. I'm excited.
You have made quite a bit of history on your own and have done a lot in the community in terms of educating people with health. We are really talking about down home healthy cooking, but in a healthy style.
Absolutely.
Maybe eating some of the things that different cultures like to eat. At different times we're going to go to Asian food, Indian food, all types of American food. Today we're dealing with more of what type of food?
Well, what we're doing is, the ideal is to bring back that nostalgia from grandma cooking the turkey and dressing, greens and yams. And so that's what we're going to start with today. But the health twist on it, Dr. Watson, is that we're going to take out a lot of the sugar.
And that's what we're talking about, because, diabetes is a major problem, particularly in our community and Hispanic community, various other communities.
Absolutely.
High blood pressure, heart disease, the number one causes of death. What do we have here today for this meal? Okay,
so today we're going to start with the turkey. This turkey has been marinated. It's a turkey breast. We'll place this in the oven while we're starting with the breast. The next one.
How long would you typically place that? Because you're not cooking a whole turkey.
Exactly. You're talking about 30 minutes.
You cook it at 350.
Right.
Okay.
The next thing we're going to do is the yams. Now, how we mimic the yams is that normally what happens is the yams are boiled. Okay, the yams are boiled and it's stewed down with sugar and butter. You're talking about your blood sugar going up. It's going to spike it. Of course, for diabetics or anyone, it's not good. So what we do is we roast it, and we use cinnamon, nutmeg, and toss a little olive oil in there. Let me just do that here.
So you roast them in the oven?
Roast them in the oven. Okay? Little cinnamon.
That smells good.
Little nutmeg. And now what the cinnamon and nutmeg does is it kind of sends a signal to your brain that you're getting more sugar than you're actually getting. So we take this, we roast it, roast that, and then we put that in the oven.
Now what temperature and how
That
long
should
do you
cook
roast it?
about at 350 degrees for about 20 minutes. The next thing we're going to do is we're going to make the stuffing. Now this is one of the ingredients in that everyone loves. They love the stuffing, but the stuffing doesn't love you. I found something that's really interesting. Everyone is being used a lot now, and it's called quinoa.
Quinoa.
Quinoa. It's a complete protein. So the quinoa, we start with this
Looks
as
like
if
rice
this was the
almost.
bread. It favors rice a little bit, but the texture of it, it's almost like a bread when you cook it. What it is, it's a low glycemic carbohydrate. So it's gonna break down slower, much slower than any bread product or cornbread would. So we take this and we add it to the bowl. Bell pepper, we add onion, celery, mix that up a little bit, okay? 1 egg there, can you see that? Then mix that up, add a little sage here, then we add a little of the stock that we've already made, and this is a turkey stock.
Now does that come off of the turkey that you're roasting right now?
Absolutely. Some of the pan drippings is a combination of the pan drippings and smoked turkey as well. So we just put that in the oven and let that go as well. Okay? The next thing we're going to do is, of course, the infamous greens. Right? Everybody loves greens. I just cut them up, you know. Got it. Then I'll put some turkey stock in there. I will do this in about 20 minutes, Dr. Watson. There's a little onion in there, Anaheim chili pepper, and let it cook down.
And I can't wait to see what the final product looks like, and I can't wait to give it the gold plate test
Absolutely.
of the Healthbeat
Absolutely.
show. I'm ready.
Now, don't you
Oh,
get those
great.
flavors? You get those same flavors from the yam, but not with all the sugar, so you're gonna feel
It
good.
doesn't taste
Yeah.
all as sweet,
Yams are naturally sweet.
but it just tastes great. And these greens, let's see what these greens are like. I know y'all are jealous out there because this is tasting good.
If you have a business product or service and would like to advertise on Healthbeat, contact us. We feature affordable advertising for small, growing, and established businesses. Reach an accessible audience to over 4 million viewers. Promote the health and wealth of your business and give us a shot.
For advertising and sponsorship opportunities, log on to healthbeattv.info.
Hi, it's Alondra again at The Inner Athlete. So today we're going to be working on our upper body. So we'll start with shoulders, we'll move to biceps, triceps, everything that you need to look good on the beach. All right, so got my girls with me, Angie and Denise, and we're going to start with some 10-pound weights. If you're new, start with something light, whatever works out well for you. If you're advanced, go as heavy as you want. We're going to do about 10 reps on each exercise, and I'll walk you through them as we do it. All right, our first exercise will be an overhead press, and we'll do 10 reps of that, accentuating the press all the way to the top. Make sure that you're not locking your elbows out. We just want to make sure that you get the full range of motion. All right, ladies, let's go ahead and pick up our weights. All right, so you want to start with palms forward, and we're going to make sure that we fully extend all the way to the top. Here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, one more, and 10. Good. All right, next we've got a lateral raise. And again, the weights you may need to adjust based on the exercise, but we want to do this. They're strong. They probably could use heavier weights, but we'll go 10 reps here. And again, straight out to the side, ladies, here we go. 1, 2. We're not going over shoulder height, just to shoulder height, making sure you're accentuating that lift right on those shoulder caps. We're using the delt muscle here. Those are the sexy shoulder muscles that you show off in your bikinis. All right. Sorry, I miscounted. She said that was 11. I'm sorry. Okay, so next we're going front raise. All right, so the weight should be right out in front. Again, we're going just to shoulder height. Abs are in tight, shoulders back. Here we go. I'll count this time. 2, 3, 4, 5, 6, 7, 8, 9, one more, and 10. All right, next one is what I like to call a circle up. I know you can find these different exercises on YouTube or whatever, but this is what I call a circle up. All right, so you're gonna start with the palms forward. Make sure those weights come all the way in together, abs in nice and tight. We're gonna take them all the way out and up with a fairly straight arm. Again, don't lock your elbows out. Nice soft arms that use the shoulders to get all the way to the top and the bottom. So this is your starting and ending position. Here we go, 10 reps, ladies. All the way up and squeeze back in on the bottom. That's 2, 3, 4, 5, 6, 7, 8, 9, and 10. Excellent. All right, so our next portion will focus on biceps and triceps. So we're gonna grab our weights again. Palms are forward. You want the elbows to be slightly out in front, not behind. We're not using our shoulders here. We're isolating with the shoulders and using just the biceps. All right, so curling straight up, all the way to the top, all the way down is a full range of motion. Squeeze. You want to exhale on the hard part, so blow that air out. Keep the abs in nice and tight. And full range of motion on every rep. Couple more, ladies. Excellent. So our variation there will be a hammer curl where the palms will face toward each other. Again, keep those elbows in the same spot and curl it up. Squeeze the biceps, full range of motion. You want to move slowly through these reps. You don't want to fly up or down. You want to squeeze and isolate each one so you get that full squeeze and contraction on the bicep muscle. Squeeze it up. 2 more. Excellent. Good job, ladies. Go ahead and set those weights down. I'm going to come on the side of our box here. You can use a chair. You can use anything that gives you a little bit of height here, park bench, whatever you have access to. Make sure you keep your body close to the box or the bench, whatever you're using. You're gonna bend the elbows, and you can also stay on your heels with knees bent or straight legs, which would be a little bit more advanced version. All right, 10 reps, here we go. All the way down and squeeze up. 2, 3, 4, 5, 6, 7, 8, 9, and 10. Easy, easy money. All right, grab those weights again, ladies. We're doing dumbbell kickbacks. And again, for the triceps, you're gonna lean forward, elbows up. Make sure those elbows stay high. Push all the way out and squeeze in. So make sure you're not pushing your wrists, but you're actually isolating the triceps. Abs are in tight, chest up. Squeeze back. Couple more. Good. So today we hit those shoulders, biceps, and triceps. And make sure you look good in your tank tops and bikinis and sundresses. We hit shoulders with an overhead press, a lateral raise, a front raise, and a circle up. And for the biceps, curls and then hammer curls with the palms facing in. And for the triceps, the bench dips and the dumbbell kickbacks. If you want to look like an athlete, you got to train like an athlete. Join us anytime here at the Inner Athlete in San Leandro.
The Healthbeat Show, sponsored by Watson Wellness Water. Your health is your wealth.
I'm Dr. Jeffrey Watson, and diabetes is becoming a very, very major problem now, even for our young people. There are two types of diabetes. Number one is called type 1 diabetes or juvenile diabetes. It occurs in young people as a result of a deficiency of the gland called the pancreas. Type 2 is usually in adults, and it usually has to do with the body size being bigger and putting stress on the pancreas, and a cell in the pancreas called the beta cell cannot secrete enough insulin. I like to say it's like a Cadillac body trying to be driven by a Volkswagen motor. It's too much stress on the pancreas. It can't make enough insulin. Now, our young people who used to only have type 2 diabetes, type 1 diabetes, are now developing type 2 because they're becoming bigger and they have less exercise. Exercise seems to make your body more sensitive to the natural insulin. What are the signs and symptoms of diabetes? Well, losing weight real quick, getting blurred vision. If you're a woman, developing yeast infections that won't go away. And some of the men may develop yeast infections as well. Becoming very fatigued and having infections that are very difficult to heal, having problems with your peripheral vascular system, your toes, and getting sores on those. Make sure that you get a test called a hemoglobin A1C. That tells what your sugar is over a 3-month period. Ask your doctor to test a fasting blood sugar. Your blood sugar should be below 126 if you have not eaten anything, or below 186 if you have eaten something. All right, that's it. Diabetes, if you knew better, you could do better, because remember always that your health is your wealth, and when you have your health, you've got everything. God bless. I'm Dr. Jeffrey Watson. We'll see you next time. I'm Dr. Jeffrey Watson. Thanks for being with us on this episode of the Healthbeat Show, where we try to educate you about different aspects of healthcare, about eating right, exercising right, what you can do to help yourself, how to access the healthcare system, what kind of questions to ask, what you should do for any particular disease state. Because I always believe that your health is your wealth, and when you have your health, you have everything. I'm Dr. Jeffrey Watson. We'll see you next time.
You don't have to take my word, but I heard if you have your health, you have everything.